Let's look at cleft lip and cleft palate. Cleft lip. A cleft lip is a congenital condition where there is an opening or separation in the upper lip, which can range from a small notch to a complete separation that extends into the nose. Cleft palate. A cleft palate is a congenital condition characterized by a gap or opening in the roof of the mouth, which can involve the hard palate near the front teeth or extend into the soft palate towards the back of the mouth. Signs and symptoms. Cleft lip. Visible notch or gap in the upper lip, often on one or both sides. Difficulty with feeding, particularly with breastfeeding. Nasal air escape, air passing through the nose during feeding or speech. Cleft palate. Visible gap or split in the roof of the mouth, extending from the front, hard palate, to the back, soft palate. Difficulty with feeding due to milk coming out of the nose, nasal regurgitation. Speech difficulties, including nasal speech and articulation issues. Ear infections and hearing problems due to dysfunction of the eustachian tube. Nursing management provides support and education to parents on feeding techniques such as specialized bottles or nipples for cleft lip and cleft palate infants. Monitor growth and development, including weight gain and nutritional status. Assess for signs of respiratory issues, ear infections, and speech delays. Collaborate with a multidisciplinary team, including speech therapists, otolaryngologists, and plastic surgeons for comprehensive care. Surgical management and timing. Cleft lip repair, typically performed around 3 to 6 months of age, depending on the child's overall health and readiness for surgery. Cleft palate repair, usually done between 9 to 18 months of age to allow for optimal facial growth and development. Surgical techniques aim to close the openings and reconstruct the affected areas to improve function and appearance. Parent teachings. Educate parents on feeding techniques and positions to minimize swallowing difficulties and nasal regurgitation. Provide emotional support and guidance on coping with the diagnosis and treatment process. Teach parents about post-operative care, including wound care, pain management, and follow-up appointments. Emphasize the importance of regular monitoring and therapy sessions to address speech and hearing concerns. Complications. Feeding difficulties. Infants with cleft lip or palate may struggle with breastfeeding or bottle feeding due to the structural abnormalities. Ear infections and hearing loss. Dysfunction of the eustachian tube can lead to recurrent ear infections and potential hearing problems. Speech and language delays. Children with cleft palate may experience speech difficulties, requiring speech therapy and interventions. Dental issues. Cleft lip and palate can affect dental development, leading to malocclusion and dental crowding. Understanding cleft lip and cleft palate involves recognizing the physical characteristics, feeding challenges, speech issues, and potential complications associated with these congenital conditions. Nurses play a crucial role in providing holistic care, education, and support to children and families affected by cleft lip and palate. Cleft lip and cleft palate feeding techniques within infants. Feeding a baby with a cleft lip or cleft palate requires special techniques and considerations to ensure they receive adequate nutrition and avoid complications. Here are some feeding techniques for infants with cleft lip and cleft palate. Feeding techniques for cleft lip. Positioning. Hold the baby in an upright position during feeding to minimize the risk of milk flowing into the nasal cavity. Use a feeding pillow or cushion to support the baby's head and maintain a comfortable feeding position. Specialized bottles and nipples. Choose bottles with squeezable silicone nipples that allow for better control of milk flow. Look for bottles with a wide base and a cross-cut nipple to facilitate milk flow without requiring strong suction. Experiment with different nipple shapes and sizes to find the most suitable one for your baby. Paced feeding. Feed the baby slowly and pause frequently to allow them to swallow and breathe comfortably. Avoid rapid feeding, as it can overwhelm the baby and increase the risk of choking or aspiration. Burping. Burp the baby frequently during and after feeding to release trapped air and prevent discomfort. Gently pat or rub the baby's back to encourage burping. Feeding techniques for cleft palate. Feeding position. Hold the baby in an upright position during feeding to reduce the risk of milk entering the nasal passages. Ensure the baby's head is slightly elevated to help milk flow downward and prevent regurgitation. Specialized feeding equipment. Consider using specialized feeding devices designed for babies with cleft palate, such as Cleft Palate bottles or squeezable bottles with one-way valves. These bottles help control milk flow and minimize the amount of air the baby swallows during feeding. Thickened feeds. In some cases, thickening breast milk or formula with a thickening agent, under medical guidance, can help the baby swallow more effectively and reduce the risk of aspiration. Consult with a healthcare provider before making any changes to the baby's feeding regimen. Assisted feeding. If the baby has difficulty creating suction, consider alternative feeding methods such as finger feeding or using a feeding syringe. These methods may require guidance from a feeding specialist or healthcare provider. Let's take a look at lactose intolerance. Lactose intolerance is a condition characterized by the body's inability to digest lactose, a sugar found in dairy products. It occurs due to a deficiency of lactase enzyme, which is responsible for breaking down lactose into simpler sugars for absorption. Signs and symptoms: abdominal pain and cramping, bloating and gas, diarrhea, especially after consuming dairy products, nausea and sometimes vomiting, flatulence, passing gas, and rumbling sounds in the abdomen. Nursing management. Educate the patient and family about lactose intolerance, including its causes, symptoms, and dietary management. Encourage the patient to avoid or limit lactose-containing foods and beverages, such as milk, cheese, ice cream, and yogurt. Recommend lactose-free or lactose-reduced dairy products as alternatives. Provide nutritional counseling to ensure the patient maintains a balanced diet with adequate calcium and vitamin D intake. Surgical management. Lactose intolerance is typically managed through dietary modifications and does not require surgical intervention. In rare cases of severe lactose intolerance with significant complications, surgical options such as bowel resection or bypass may be considered, but these are not common approaches for lactose intolerance management. Parent teachings. Teach parents about lactose intolerance, its causes, and how to identify and manage symptoms in their child. Provide guidance on reading food labels to identify lactose-containing products and alternatives. Encourage the use of lactase enzyme supplements before consuming dairy products to aid in digestion. Emphasize the importance of calcium-rich foods and supplements to maintain bone health, especially if dairy products are restricted. Complications. Nutritional deficiencies. If lactose-containing foods are completely eliminated from the diet, there is a risk of inadequate calcium, vitamin D, and other nutrient intake. Impact on quality of life. Lactose intolerance can affect social interactions and dietary choices, leading to feelings of discomfort and frustration. Misdiagnosis. Symptoms of lactose intolerance can overlap with other gastrointestinal conditions, so it's important to confirm the diagnosis through testing before implementing dietary changes.